Welcome back to Critical Moments with the Neonatal Nurse Educator, Part 10. Today you are taking care of a baby on the jet ventilator. This baby is a 10-day-old X24 weeker who was put on the jet initially as routine care in the NICU you work in. Now they do have some signs of PIE, and so the settings have been changed over the last 10 days. Currently, we're on a rate of 420, a PIP of 22, a servo of 1.4, and a FiO2 of 50% with a PEEP of 6. You've noticed that the chest wiggle just isn't as good as it used to be. And sometimes when we're on conventional ventilator, we often think to ourselves we're watching the chest rise and fall. But on the jet, we have to pay attention to the wiggle. Not only that, but your baby's on a TCOM, which is rising, and their FiO2 requirement is rising. You draw blood gas. It's one of the ones that stops us in our track. A pH of 708, a CO2 of 92, and a bicarb of 28. Severe respiratory acidosis. Could this be a malfunction of the equipment? Great things to start with are to check your tube. Is your tube in the right place? Remember, using our gum is our marker because our gums don't move, but our lips sure do. Checking for clogging. Is there secretions in the way? Is the vent delivering the breast to the baby? If we don't see the wiggle, it may not be. Is it positional? Do we need to move the baby? If we take the baby off the ventilator and start bagging them, do we see a change in our TCOM? And that is the case in this scenario. When starting to bag on the conventional ventilator, the baby recovers via the oxygen requirements and what's happening on their TCOM. The respiratory therapist is called to the bedside and assesses that there was a disconnection in your equipment. I want to remind you that respiratory acidosis is not always a baby problem. Sometimes it's an equipment problem. And it's important to not only look and see what our baby is doing, but to compare that to what our ventilator should be doing.